This was a 47-year-old gentleman from a neighboring country with a history of trauma to the right eye with a cricket ball, who presented with decreased vision due to cataract and about 180 degrees of superior zonular dehiscence and was posted for surgery. One can see the extent of the subluxation under the operating microscope. The initiation of the rhexis itself showed the tendency of the bag cataract complex to tilt forwards. With the forceps, the rhexis was completed with utmost care. 3 side ports were fashioned superiorly and capsular hooks were used to suspend the superior rhexis margin. Then a capsular tension ring was implanted in the bag through an inferior side port. These maneuvers caused a very evident anterior subluxation of the superior hemi bag into the anterior chamber, and one can visualize the CTR here in the bag in the anterior chamber. I decided to proceed with the phacoemulsification with the hemi bag in the anterior chamber. After the initial nuclear crack, the emulsification was a difficult process with the soft nucleus. Viscoelastics were used liberally to viscodissect the epinucleus nucleus from the bag. Rotation was achieved with the probe and the second instrument, taking care to maintain the plane of rotation along the tilted plane of the bag to prevent further dislocation of the bag complex. The superior iris provided support to the bag complex here. After emulsifying the superior heminucleus, the second instrument was used to dial the inferior heminucleus into the anterior hemibag, again along the plane of the bag, and emulsify. After partial cortical aspiration, an iris hook was implanted to facilitate the proper cortical cleanup from the whole bag. Here you can see the hemi bag with the CTR in the anterior chamber quite clearly. Under viscoelastics, the capsular hooks and the iris hook were removed, and a spatula was used to nudge the CTR bag complex gently into position. The lens was then dialed into the bag and viscoelastic cleanup done. After side port hydrations, the main port was sutured and air left in the anterior chamber. The patient had an uneventful visual recovery with plus 0.75 diopter cylindrical at 90 degree, leading to 6/6 vision 7 days post-op, and is doing well on 6 months follow-up.